Hi you guys, my name is Makaya Fitz, and today I'll be doing a presentation on probiotics versus antibiotics for treating bacterial vaginosis in women. Let's get into it. So the purpose of this slide right here is to actually tell you the purpose of my research. So I actually did some research on bacterial vaginosis in women of childbearing age, or women that just keep having reoccurrence of bacterial vaginosis. So we know this is one of the most common things in women, so we want to get to the bottom of it so that we can help women stop having reoccurring of bacterial vaginosis. Here in this slide, my PICO question is clearly stated. I'm going to give you a minute to think about my PICO question as I'm reading it to you. In women of childbearing age experiencing bacterial vaginosis, how effective are probiotics and prebiotics compared to antibiotics in reducing bacterial vaginosis symptoms and preventing reoccurrence? Just take a minute and think about that question. Okay, so in these next couple of slides, I'm going to be talking about the articles that I chose. So in this first article, it is a quantitative article, and they use random controlled trial study. So this article talked about probiotics and antibiotics together, and then antibiotics used alone. So what they did was take two groups, and the first group had antibiotics and probiotics, while the second group just had antibiotics. So in their findings, they found that the group that had probiotics and antibiotics versus the group that had antibiotics is that the group with probiotics and antibiotics had a lower rate for reoccurrence. So this will make this a useful article to use because it provides good support for using antibiotics in conjunction with probiotics. So in the second article, this is a level 1 evidence, meaning that this is a systematic review, meaning that the researchers did their research on different websites to get their support, their evidence, to make this all come together as to make their research article. So in this research, they tried to determine the effectiveness of probiotics and prebiotics in treating bacterial vaginosis in both pregnant and non-pregnant women. So they examined probiotics and prebiotics alone and combined with antibiotics. So in this finding, they found that it improved bacterial vaginosis cure rate, and it lowered inflammation indicators and were relatively safe with little side effects. So this is a good article to use for finding evidence-based practice, particularly in patients with recurrent BV. So this article right here is a quantitative article that studied meta-analysis. So in this article, they used 18 randomized control trials involving over 1,600 women to determine the effectiveness of probiotics in treating bacterial vaginosis. So within their study, they discovered that probiotics combined with antibiotics significantly increased BV cure rate and reduced reoccurrence compared to antibiotics alone. They also found out that probiotics had a more favorable safety profile with few reported side effects. So this is a qualitative article. So this article addresses the problem of recurrent bacterial vaginosis and how it impacts the lives of women. So the study is to explore women's experience with recurrent bacterial vaginosis and understand their clinical experience. So within this article, they interviewed 35 women on their recurrent bacterial vaginosis treatment and their clinical care experience. The researchers discovered that women were dissatisfied with current treatment options, particularly antibiotics, because of the results, like reoccurrence and unwanted side effects. So these findings shed light on the lived experience of women with recurrent bacterial vaginosis, emphasizing the need for better treatment options, enhanced communication, and increased support for healthcare providers. These findings can also help healthcare providers build more patient-centered care programs that addresses both the physical and emotional elements of bacterial vaginosis. This slide right here is the key findings of each of my articles, but the first and second one are similar, which is basically that probiotics and antibiotics, prebiotics and antibiotics are combined together are going to work to reduce bacterial vaginosis recurrence and increase bacterial vaginosis cure rate. So for my third article, we know that probiotics are effective, safe, and well tolerated, and that you have less side effects with probiotics, and it also restores the health of the vagina. And then in my fourth article, this was just like women just giving their experience from not only the treatment but their experience with the healthcare provider as well. So in this slide here, we talk about my common findings and disagreements about each article. So each article did talk about how probiotics and antibiotics combined would lower the rate for recurrent bacterial vaginosis, while the differences was that in Article 2 and 3, they covered prebiotics and probiotics, while 1 and 4 didn't do that. Also, 4 also talked about patient dissatisfaction with the treatments and how the patients talked about their primary physician as well. And also in 1 and 4, it doesn't emphasize on standardizing the use of probiotics. So putting all my information together, my evidence together, to answer my PICO question, I think that combining antibiotics, probiotics, and prebiotics together will make a greater outcome to lessen the symptoms of bacterial vaginosis and prevent reoccurrence. So some of my suggestions would be for women who have recurring bacterial vaginosis is to combine probiotics with antibiotics. Also, as a healthcare provider, to educate the patient on bacterial vaginosis and its reoccurrence and the available treatment such as probiotics. As a long-term management approach, rethink the regular usage of antibiotics and think about adding probiotics with the antibiotics. And no other research, in my opinion, requires more investigation. There is significant information in the existing studies today. So if I were to implement my recommendations, I would evaluate the effectiveness by monitoring the reoccurrence and use clinical outcomes for evaluation. I will also include patient education as well to make sure that they understand the significance of probiotics and antibiotics. And I will also administer tests to observe the patient's outcome. And I will also let the patient do a survey to let me know how well it's working.